Hi guys, today we're here with Dr. Susan Briley, who is a board-certified colon rectal surgeon. Welcome, Doctor.
Thank you.
Now, we've talked in the other segments a little bit about hemorrhoids and also about colon and rectal cancer. Now, there are some other problems that we can have. Let's talk about that.
Yes, I want everybody to know that when you have something in the anal area, it's not necessarily hemorrhoids. Everybody who comes into my office with itching, anal pain, anal protrusion, bleeding, they think they have hemorrhoids. And sometimes they do, but many times they don't.
Mm-hmm. Now, what are some of the things that you most commonly see?
I'd say the most common diagnosis is that of an anal fissure, F-I-S-S-U-R-E.
Okay.
An anal fissure is a tear or a crack in the anal canal. We can get it from constipation, diarrhea, or sometimes it just happens. The symptom is painful bowel movements, usually accompanied by bleeding. Mm-hmm. The pain can be severe, and it can linger for hours after bowel movements. And just about every fissure patient thinks they have hemorrhoids, but the treatment is different. So it's important to get examined by a colon and rectal surgeon and make sure that this is a fissure or hemorrhoids and treated appropriately.
Now, I know we talked about the cancer specifically before, and that perhaps that's more in the upper age group, and obviously hemorrhoids can be across the board from pregnant women, as you said, to secretaries, to weightlifters, whatever it might be. But this condition, I imagine, could happen at any stage of life. Yes,
it can even happen in young children who I don't treat, but I see late teenagers, and usually people in their 20s, 30s, and 40s who have an anal fissure that can be treated. As with most of my conditions, I first treat it with psyllium fiber, which bulks the stool and helps the bowel movement not be painful. But there are also some prescription creams that I prescribe for treatment of a fissure. If that's not successful, then we have two surgical operations that we can do, one more and one less invasive, for treatment of a fissure, and that's 90% effective in healing it for good.
That's fantastic. Now, I imagine it is also something that with that surgery that you would perhaps recommend some dietary supplements so that that sort of thing doesn't happen again, the hardening of the stool.
Mm-hmm.
Yeah.
Yes, psyllium fiber.
Psyllium fiber.
That's
it sounds like
secret.
It's across the board. And so, other than the fissure condition, what other things might we see?
There are things that are less common, but can have very similar symptoms: anal pain with defecation, protrusion, itching, drainage of mucus, or even pus. Severe pain can be a signal of an anal abscess. Mm-hmm. This can be a very serious condition and one that demands urgent treatment. Along with an abscess, sometimes even after treatment of an abscess, there can be something called an anal fistula. A fistula is an abnormal opening between the inside of the rectum or anus and the outside. Okay. And that requires some specialized surgical treatment, but it is something that I see pretty commonly.
Are there any other problems that you come across?
There are lots.
Sure, I bet. Yeah.
And we can't talk about all the symptoms, but I treat rectal prolapse, also not an anorectal condition, but diverticulitis, Crohn's disease, ulcerative colitis. All these may require surgical intervention at some time. Mm-hmm.
Now, what would you say to the people at home, perhaps, who think they might have some kind of issue?
Just come in and get examined.
Yeah.
Mm-hmm.
And
if
I think
it's that bothersome, it often needs another set of eyes. And the best way for me to diagnose a problem in the anorectal area is to look and to palpate and maybe even do a rectal exam, which people don't like, but it's not that bad, and it's over quickly.
Mm. And a rectal exam is a lot better than rectal cancer, let's be honest.
That's right.
So prevention is far better than cure. Thank you so much, Dr. Susan Briley, for coming in. We've had a fantastic conversation about a number of different subjects. And of course, if you need any more information on Dr. Susan Briley's practice, then we'll put all the information at the bottom of the screen. Thank you again, Doctor, for coming in, and we'll see you next time.